to get up to speed on this important week, let's just turn to the latest reporting about what's happening with the Trump presidency and in the nation. First, as Toluse Olorunnipa writes for the Washington Post, the Trump administration has now sidelined or replaced officials not seen as loyal. They've rebuffed congressional requests for testimony, dismissed jarring statistics and models, praised states for reopening without meeting White House guidelines, and briefly pushed to disband the coronavirus task force. Here's what the president had to say earlier Friday.
What we've done has been incredible. We're going to continue to do it. We're going into transition, and I call it transition to greatness. It's going to be transition to greatness because we're going to do something very fast, and we're going to have a phenomenal year next year.
But as Peter Baker writes in the New York Times, for a president who had staked his legacy on an economic record that was shredded by the crisis, moving on may seem like the best way to salvage his chances for re-election this fall, even as the latest death toll estimates have more than doubled from what Mr. Trump predicted just weeks ago, and polls show the public is not ready to restore normal life. So the question in my notebook is this: what's next? What does it all mean? And what will Congress do? To get answers, we turn to one of the best reporters on Capitol Hill, Susan Davis, congressional correspondent for National Public Radio, to the author of a revealing new biography, a terrific book, Molly Ball, national political correspondent for Time Magazine and author of Pelosi on the Speaker of the House, to Peter Baker, chief White House correspondent for the New York Times, and Toluse Olorunnipa, White House reporter for the Washington Post. Tolu, begin with you. You've reported all week on the president clashing with health experts, with scientists. What does it look like behind the scenes in the White House?
Well, aside from the daily chaos that we have seen in response to the coronavirus, we are seeing this major shift. The president was actually pretty transparent about the idea that he wants to transition away from focusing on the public health crisis, which continues to ravage the country with tens of thousands of deaths, and he wants to shift towards talking about the economic comeback. He has 6 months between now and his election, and he realizes that that's a very short amount of time to try to restore the economic situation that was in place before this crisis. Now we're at a place where we're at close to 15% unemployment, and the president wants to shift towards completely focusing on the economic comeback, turning the story around from being this public health crisis where tens of thousands of people are dying into this story of an economic comeback. That is why he is sidelining a lot of these health officials. That's why he's saying that top public health officials are not being allowed to testify before Congress. His administration is downplaying all kinds of scientific data and models which show how bad of a situation this is. And they're trying to sort of shape the narrative by not letting some of this bad news and some of these negative statistics get out. Instead, the president is focusing on the economy completely and having this shift that's really about the political calendar in which he has 6 months to prove to the country that we are in the middle of an economic comeback.
But they're not the only players, the White House and the president. Sue Davis, when you talk to lawmakers, they are bringing Dr. Fauci before the Senate next week. Dr. Rick Bright, the whistleblower from HHS, he's going to go before the House. What do they want to learn next week when those two figures come to the Hill?
Well, I think both hearings illuminate why so many lawmakers are eager to get back to Washington. The Senate obviously returned this week. The House is looking at returning as early as next week. You know, Fauci will face a much more bipartisan room. The lawmakers across the spectrum have an interest in hearing from him directly. There's a lot of questions that Congress still has about testing capabilities, why testing isn't where many of them thought it would be in the previous packages that they passed into law. Many of them want to hear directly from him about what the timeframes look like for vaccines or possible treatments. And a lot of them are trying to grasp what the long-term scope of this looks like in the debate over what and how much more legislation they're going to have to pass. Dr. Bright is going to face a much more partisan hearing, and I think that reflects that the tone on Capitol Hill is shifting to some familiar partisan battle lines here. He's accused the White House of removing him from his job because he wouldn't support the White House line about using an anti-malaria drug because he said it didn't have the scientific backing. The government lawyers today said he may have a point and said he should be put back into his job until they can sort of figure out what was involved here. And Democrats are going to use this hearing to point to what they say has been mismanagement across the board at the White House. And I think that's going to be where a lot of the conversation is on Capitol Hill going forward. Less about the pandemic and administration managing not just the public health crisis, but the economy going forward.
Molly, you've been studying the Speaker. talking to the speaker. You think about, we only have 6 months between now and the election. There's already been an impeachment process. What are her tools? Does she issue a subpoena to Dr. Fauci to come to the House? What does she do to try to contain this president?
Well, she did say in an interview earlier today that she hoped not to have to subpoena Dr. Fauci. And I think at this point, her eyes are, as far as containing Trump, trying to stop Trump, as so many on the left would like her to do, probably more aggressively than she has. I think she's set her sights on November, the way, and she's trying to signal to her party that if they want to constrain the president, they should focus on the election. What she's trying to focus on now is dealing with the crisis, getting legislation through the Congress, doing oversight, but as Sue said, focusing the oversight on the ongoing management of the crisis. There have been a lot of calls from the left to also do investigations and oversight of what led to this point, but that is not the focus. I think even for the Speaker and the congressional Democrats, they want to focus on what they can still do, particularly since so many believe that the White House has not been up to the task. The Congress is trying to fill that void. They're trying to figure out what they can do to try to help all the Americans who are out of work, to try to address the public health crisis, to try to shore up the public health system, to try to help the states that have been given so much responsibility, and try to ease some of these coordination blockages that have been occurring. So, but at the same time, a lot of lawmakers are really confused because they haven't been on the job in Washington, because they've been all over the place. There's not a lot of not everybody is on the same page, and I think there's a lot of confusion about how and where they're going to proceed.
That point about confusion, Peter, it reminds me of the story you just filed for the New York Times tonight about the coronavirus now being part of the White House story, a staffer for Vice President Pence, a personal valet for President Trump. Is having the virus now up close and personal in their life affecting their thinking, their decision-making at any level?
Well, not so far as we can tell at this point, but the timing is rather remarkable. In the same week that the president is telling businesses and states across the country that it's okay to start reopening, and not only okay, but they should definitely start to do that, he sees the virus literally surrounding him now in the White House. Just 2 cases so far. Hopefully that's all there'll ever be. But to have it be a personal valet who, helps the president in the residence, and to have a top aide to the vice president who is often with him and in fact has been one of the chief spokespeople for the White House efforts to curb this virus, both turn out to be infected, I think is a really pivotal moment, because it suggests that if the White House, the most prestigious and resource-intense workplace in the country, cannot completely shut itself off to this virus, how can workplaces across the country do that? If the White House, which has access to tests, not only the tests weekly or monthly that other businesses might try to impose, but daily, cannot, in fact, prevent the virus from being in part of its workforce, what will these other businesses do? And I think that's a moment where the president could give some examples or could give some guidance to the country about how he thinks they should proceed, given how he's proceeding. But instead today, I think he tried to brush it off. He said nice things about Katie Miller, of course, who's been a loyal aide to him and is married to Stephen Miller, another loyal aide to him. But he said this is the problem with testing. We can be tested negative one moment and then tested positive the next, and therefore testing is of limited utility. That leaves the country wondering, okay, then what are we supposed to do? Just this week, the Harvard Global Health Initiative said we need to be doing 900,000 tests a day, and right now we're doing 250,000. And that's a real problem for a lot of businesses as they think about what to do going forward.